3.
Hey everybody, Dr. Dan here. Just wanted to shoot a quick video, talk to you guys about our technique here in the office and why it is that we focus so heavily on the upper cervical part of the spine. We do practice a technique in the office called upper cervical specific, and a lot of people have questions about that because as you can imagine, people come into our office with a whole host of issues and pains and discomforts and things like that, and they are certainly not all centered right up here at the very top part of the spine, which is where we primarily focus our care and our adjustments. Okay, so I want to address that so that you can understand why it is that we are doing the things that we're doing whenever you come into the office. So number one, just remember that chiropractic as a science, as a technique, is primarily used to remove pressure from the nerves and the nervous system so that the body can function at 100%. So when you're thinking chiropractic, when you're thinking adjustments, when you're thinking the way that the body heals and functions, I want you to think less about the backbone and more about the nerves and the nervous system that is inside of those bones, okay? So when we're looking at the spine, the highest concentration of nerve tissue is right up here at the very top at an area called your brainstem. Billions and billions of fibers run right through that upper part of the spine. Also, that upper part of the spine is one of the areas that will misalign or subluxate the most frequently and the most commonly. Why is that so? The rest of the spine actually locks together with a whole bunch of joints and with muscle tissue and with ligaments, all sorts of things to keep the spine stabilized, okay? So when you get to the top part of the spine, there's a whole lot less of that stabilization factor, and because of that, it can shift out of position a whole lot easier than the rest of the spine does, okay? So when we're looking at the nervous system and we're looking at the effects on the nervous system, the upper cervical part of the spine is going to be the most prominent area that needs to be addressed and adjusted. That part of the spine also controls most of the normal functions in the body. So things like your heart rate, your blood pressure, your digestion, even your immune factors are all coordinated by nerves that come right out of the top part of the spine. So that part of the spine has an overreaching effect on the way that the body functions, and most importantly for our patients, the way that the body heals from day to day. When we're looking at the upper cervical part of the spine, we want to see, is that thing shifting out of position? If it is, then the adjustments are designed to put it back into its proper positioning, open that area up and take the pressure off of the nerves and the nervous system and allow the body to heal and function properly. If you'd like to find out whether or not upper cervical care could help you with whatever health condition you're dealing with, if chiropractic somehow will play a role in your recovery, please call the office, set up a consultation. We always talk to new patients at no charge. So it's just time for you to come in. We can talk about these things in greater detail. We can talk about what's going on with you. Let us help you if we can. Thanks.